So I'm going to turn it over to Rachel now, who's going to take over the next slide. And I'll just say Rachel is a qualified primary school teacher in the UK, and she moved into the field of education and emergencies 4 years ago. And doing that, she worked with a national organization in Lebanon, with a refugee service provider in Egypt, and with an Italian organization in northern Iraq. And she's currently the PSS-SEL project manager for the Interagency Network for Education and Emergencies. So Rachel, thank you so much for being here, and I'm going to turn it over to you.
Thank you so much, Ellie. So yes, good morning, good afternoon, good evening, wherever you're joining us from. And as Ellie said, it's Eid al-Adha today, so Eid Mubarak. Kul am wa antum bikhair to all our Muslim colleagues. I just want to say huge thanks to Indiana University and to Ellie, especially for this opportunity to be part of this wonderful initiative. I joined the first webinar, and it's really wonderful when my job at the moment is quite detached, let's say, from actual education implementation. So it's just wonderful to be in touch with all you as teachers and educators, and to hear from all of you. And also a huge thanks to our panelists who we're going to hear from shortly, for joining us on their holiday. So sorry about that. So before we hear from the real experts in the field, I'm just going to take a few moments at the beginning to frame the topic for this webinar. So that I imagine that all of our teachers and educators joining from the US are very familiar with the concept of SEL. So SEL, or social emotional learning, has become somewhat of a buzz concept in education over the past decade or so. And I imagine that some of you might have mixed feelings about how effective it is, depending on your school context, your access to professional development, and perhaps the specific SEL curriculum that you've been asked to teach. But what about PSS? What is PSS? Maybe this is a term which is less familiar to some of you, or today might be your first introduction to PSS. So we're talking here about psychosocial support, and these are interventions that support well-being. When we talk about psychosocial well-being, we're talking about psychological well-being and social well-being. So psychosocial well-being is influenced by psychological strengths and by positive social experiences. Psychological strengths might include daily practices, beliefs, rituals that give life meaning. And these are activities that help us feel safe and secure and improve our mental health. And then positive social experiences, as you might imagine, these are such relationships between friends, with our supportive family and community members, and help create a sense of belonging. So families and communities play an essential role in supporting psychosocial well-being. In the education emergency sector, in the humanitarian sector in general, sometimes there's a bit of confusion between the distinction around PSS and SEL. One way I find, one way of viewing the relationship, let's say, between the two, is to think about PSS as the umbrella term for all of the services and interventions that support well-being, and SEL as a particular strand of that, as a particular pedagogy through which specific skills are taught in order to improve well-being. So PSS as the umbrella and SEL as a strand of that. So PSS interventions are largely viewed as part of humanitarian responses because they help people who are exposed to conflict, violence, and disaster to cope better, and also to sort of support their recovery. And in the humanitarian field, we often understand these types of interventions within this pyramid that you're seeing on the screen there. So the layers of this pyramid indicate the proportion of a population that might need access to these certain services, but it doesn't necessarily, I don't think, very clearly indicate the kind of bidirectionality of these services. So just very quickly looking at the bottom layer, thinking about basic services and security, these should be available to everybody during a crisis. or humanitarian context. And that might include things such as schools, if we're thinking about the education setting, school safety and security plans, referral mechanisms to mental health service providers, and then the establishment of a safe learning environment, a positive school climate to ensure dignity and well-being of children. In the second level, we're looking at community and family supports, and this might be services or interventions that are available to students and their families and also teachers. So within that layer of the pyramid, we might think about social and emotional learning would fit into that second one from the bottom. Then kind of recreational activities, student clubs, art-based interventions, art therapy, music therapy, and then services for caregivers such as positive parenting programs. And then also for the very important teachers, teacher wellbeing initiatives, and training and ongoing supervision would fall within that layer. Moving up again, layer 3 is focused non-specialized support. So these are psychological interventions that are delivered by trained and supervised workers for children, such as caregivers, teachers, psychosocial support workers, and these include the social and primary health services. And then the top of the pyramid is outside, let's say, the bubble of PSS-SEL, and these are the specialized services. So this would be mental health care providers, clinicians, and trained professionals. So that was a very whistle-stop tour of PSS. Next slide, please. So you're probably more than familiar with SEL. SEL aims to foster qualities such as self-awareness, emotional literacy, cognitive flexibility, improved memory, resilience, which I'll come back to in a moment, persistence, motivation, empathy, social and relationship skills. Many of you will probably be familiar with the CASEL framework. So CASEL is often considered to be a leader or almost the default for SEL in the US, because it's really most effectively brought together experts, practitioners, policymakers to accelerate and sustain SEL in communities in the US. And for this reason, SEL has, and CASEL rather, has gained kind of visibility and great uptake in a lot of states. So having said that, there are many other SEL frameworks in existence, and the majority of SEL is developed in what we call the global north or in Western contexts, but increasingly we're finding SEL frameworks which have been developed in education and emergencies context, crises context, to respond to the specific needs of students facing further adversity. So this slide here is actually a screen grab from a site called Explore SEL, and I'll drop that link in the chat a little bit later, but I do encourage you to explore SEL. Through this website, you can essentially compare and contrast different SEL frameworks and look at how the skills or the qualities that are being taught link, interrelate or don't between two different frameworks. And there's a lot more to learn on that website. So yes, I'll drop the link in the chat later and you can take a look at that. Next slide, please. So we know through a lot of evidence-based research that there are huge benefits to incorporating PSS and SEL into education. To name but a few, it can enhance academic achievement and attainment, improve school attendance, engagement and motivation, and reduce negative student behaviour in schools and community. But what happens during a global pandemic such as the one we're experiencing today? Well, as we all know, the learning has had to shift and move to distance learning, and you've all had to adapt your teaching to using new modalities. And the same is true for PSS and SEL. Moreover, these interventions become even more vital during a crisis because of the impact that not only the pandemic, but also being out of school is having on your students' well-being. So they will be facing multiple challenges, additional challenges to what they're used to, including pandemic-related fears about their health, about the health of their loved ones, but then also separation from friends, from school, from other supportive communities, maybe a lack of access to free school meals, increased exposure to domestic violence, and then a kind of generalized stress and anxiety about the state of the world, and are things ever going to return to normal? What is normal? So you might be starting to think about or linking the importance of PSS in recovery, and how this might be adapted for your setting and for your students who are still in the midst of this crisis. So hopefully today's presentations will give you somewhere to start. After the webinar, we'll be sharing some open source materials with you that will hopefully support you. And I'll also share my email address and encourage you to get in touch for any specific resources or any questions that you might have. Next slide, please. So just finally, a note on SEL, equity and anti-racism. So as we're here to discuss SEL, PSS, and indeed the positive outcomes it can have on student well-being and academic success, it must also be mentioned that in many settings, there's, I would say, a dangerous tendency towards whitewashing of SEL. So one prominent researcher, practitioner, Dina Simmons, says the following: social emotional learning skills can help us build communities that foster courageous conversations across difference, so our students can confront injustice, hate, and inequity. SEL refers to the life skills that support people in experiencing, managing, and expressing emotions, making sound decisions, and fostering interpersonal relationships. However, educators often teach SEL absent of a larger socio-political context, which is fraught with injustice and inequity and affects our students' lives. As an SEL practitioner researcher who speaks nationally about the intersection of emotional intelligence, equity, and cultural responsive practices, I hear that educators shy away from such discussions for fear that they will be accused of politicization or that they will lose their jobs. So what I wanted to capture here is the importance of context, and this also applies to humanitarian settings, as you'll hear from our panelists, but also to your own school communities. So we have to think and be very conscious of when we're teaching skills like resilience or grit, we also have to think about how we frame it. So are we telling our students they need to be more resilient because they themselves are personally lacking something? Or are we framing it that they need to be resilient in light of oppressive systems that they might be living under, such as racial inequity, that they are not personally responsible for? So I just want to leave you with that thought, and maybe we can come back to that in the breakout groups. But now it is time to hand over to our panelists. So next slide, please. So first of all, you're going to be hearing from Tivkaa, who is the MHPSS, so that's Mental Health and Psychosocial Support Specialist for Save the Children, and from Dr. Wakil Bukar, who is the Education Specialist for an organisation called FHI 360 in Nigeria. As you're listening to their presentations, I really encourage you to post questions in the chat that we can come back to later. So that's all from me, and I'll pass over to Dr. Wakil and Bem. Thank you.
Thank you very much, Raquel. This is Dr. Wakil. As you have introduced me, I am the teacher education specialist working for FHI 360 under the project AENN, Addressing Education in Northeast Nigeria. Next slide, please. The context we are working is a crisis context. Northeast Nigeria for almost over a decade, experiencing a crisis a crisis due to insurgency by armed opposition groups that led millions homeless, and the worst hit segment of our development is education. For the last 3 years, we can see students were displaced, teachers were sometimes outrightly killed, and then school facilities were destroyed. And so the intervention by this project, AENN, is trying to address those education crises that cause adversities to a large segment of the population. The project is funded by USAID. It's a 3-year project starting from September 2018 to be last year in February 2021, September 2021, I mean. Yeah, then it's covered 2 states of Nigeria, 2 states of the Northeast that are worst hit by the crisis. And the communities that are targeted are about 225 communities in the 2 states in 8 local government areas. So the area of intervention, how we intervene is through non-formal learning intervention, as well as safe formal learning support. The target of the project is about 302,500 children and youths. These are our targets. So that is the scenario. If you look at this picture, that is a picture at the peak of the crisis. You can see children probably escorted with their parents or caregivers. You can look at traumatized faces. These are, they trek hundreds of, tens and hundreds of, sometimes hundreds of kilometers, because a distance from like place like Goza down to Maiduguri, you see children with their parents trek down to safer places. So this is a serious, crisis that affected children. These children, they are cut off from schools. They are cut off from the normal thing that children are supposed to enjoy in their lives. So as a result, we have a serious psychological distress. In fact, some of the states reach the toxic stress stage that need to be healed. BEM can add more, because we are going to co-present this.
Yeah, thank you very much, Dr. Wakil. Next slide. So the crisis in the Northeast has affected teachers and children. It has already overstressed the weak education system in the Northeast, which was an issue before the insurgency. So statistically, it shows that over 2,295 teachers has been killed, over 19,000 others displaced in Borno, Yobe, and Adamawa states, which comprise of the Northeast. And we have an estimated number of 1,500 schools which were destroyed since 2015, with over 1,280 casualties among teachers and students. So the insurgency in the Northeast has stressed the already weakened structure. Historically, the infrastructures, the education system in this part of the country, Northeast Nigeria, was already weak, and with the insurgency, it has overstressed it. And for that, it has pushed so many children out of school, and so many teachers have lacked the capacity again to continue delivering quality education to children. The destruction of schools began in 2009, with schools repeatedly attacked over the years. During the most acute phase of the conflict, all schools in northeastern Nigeria were closed from December 2013 to 2015. So teachers were displaced and killed. Students were adopted as cases of Chibok girls and the Dapchi girls, which is a global, I think everybody's aware of that happenings. Some children were used as suicide bombers. Most teachers and students have lost their parents, their caregivers, and other significant ones in their lives. Therefore, both teachers and children have undergone psychosocial distress that has impacted on their learning. Teachers too have undergone some psychosocial experience. Some have suffered directly, some have suffered indirectly, that have affected the ability to impact in children as they are supposed to, as a role of teachers in the crisis. And so in AENN, we look at social-emotional learning and PSS as a protective and illustrative approach whereby we can help the children bounce back to normal life. We can help the children get ready to learn. We can help the children to be stable, to plan, to be engaged in educational activities. Because if what they have gone through, the curriculum will not include social-emotional learning, PSS activities and lessons, definitely learning cannot take place. Because what they have gone through will always be interfering with their well-being and learning. And so for AENN, we develop PSS and social-emotional learning activities to support children's abilities to think, to plan, to concentrate, to relate, to understand, cope and bounce back with their normal lives, as well as help teachers deliver their roles in the crisis context. Next slide. And so as Rachel was able to take us through the executive functions, the SEL competencies, the emotional regulation, positive social skills, we'll be brief on it, but basically in AENN, we try to look at areas that we can help children develop their executive functions. We help them to regulate their emotions, to have positive social skills, and the ability to resolve conflicts. Because without all this, it will be difficult for them to learn. So AENN uses a contextualized PSS approach, which is based on the psychosocial needs of the students and the teachers that are experiencing psychosocial distress. To achieve this, AENN adopts a teacher training and classroom delivery model that are activity-based, so as to create a platform where SEL activities can be infused into literacy and numeracy lessons in addition to the SEL standalone. So in AENN, we try to look at how we infuse PSS and SEL activities into the SEL and into the numeracy and literacy curriculum to help children develop, concentrate, plan, be organized, be focused, and manage their own stress and distress so that learning can take place effectively. And so, before starting actual learning activities, we do engage the children in safe spaces, which we normally have sequential SEL PSS activities, which help them to cope with their psychosocial distress they have experienced and get them ready to be successful in the non-formal learning centers. And so we have sequential PSS and SEL activities whereby the children will first come in contact with, they do embark upon, we prepare them, then engage in things like maybe things like knowing themselves, because when they come together during the SEL spaces, we help them with some PSS activities such like knowing your names, where they come together, they understand the name of each person, they sing the name of each person, which help them in their positive social skills. So at the start of the non-formal learning centers, in the first 15 weeks, we have several lessons that focus on bringing children back to focus and preparing them for greater learning tasks. So we embark on scripted lessons. Either they engage in playing brain games or doing mindfulness activities. We take them gradually as a move, and we mainstream them from the self spaces to the non-formal learning centers. The first 15 weeks, we engage them in brain games and mindfulness activities so that they will be stabilized, they will be focused, they will have the concentration needed for them to continue learning the other components of the curriculum, which is literacy and numeracy as well. And so from the week 16 to 36, we have social-emotional learning lessons, which are introduced on average of 3 lessons in a week in a pattern that the facilitator or the teacher prepare before the activity, then embark on a warm-up activity, then the facilitator embark on a presentation, and then practice with the students, and then allow the students to perform, and the teacher review it, evaluate it, and see where they have needs, if they need any other services or they need any other approach. Then the facilitator look at the best possible ways that he can help them or support them to learn better for their well-being as well. So AENN have looked another approach whereby we have wrote an approach of having social-emotional learning standalone lessons and then the ones that are integrated. So by doing this, we conducted a randomized group where we try to see students who have received SEL as a standalone and those who have integrated it. So we did a random assignment of numbers to all the 225 communities we are implementing to ensure that in each community there is a non-formal learning center that has a social-emotional learning integrated in the literacy and numeracy, so that by the end of the end line, we try to weigh it and see if it would be better to be having SEL as a standalone lesson or to be integrating SEL in literacy and numeracy. Dr. Wakil?
Yeah.
Yeah.
In the context we are working, SEL is not enshrined in the formal learning system. And it is very difficult to introduce SEL as a standalone subject. For curriculum to be reviewed in Nigeria, it has to take a longer process. So as a result, FHI thought that let's try and evaluate 2 scenarios that whether SEL can be fit in. That is the rationale behind the randomized controlled trial. The centers we have are divided into 50-50 using random process based at the community level to integrate SEL activities into numeracy and literacy lessons, and then teaching SEL as standalone subject. This randomized trial was going on before the COVID-19 pandemic set in. So the evaluation of the result is not yet out. It is on the process before we close for due to the pandemic. So I think it will be an interesting thing. We get the outcome and see the 2 scenarios, which one is more effective, considering the fact that there is a difficulty in in infusing the SEL as a standalone subject in our our formal schools, so that this formal school system can adapt the SEL add-on process. SEL can be added to any of the school subject, and then and if it and be effective. If at all the randomized control trial yielded a very positive result. Yeah. So now I think we go ahead with how we deal with SEL during COVID-19. So we now, because of the children are, at home, schools were closed, so we devised a means of reaching out to these children through a remote learning system. We use the interactive radio instructions, and then we send SMS messages to caregivers with a guided lesson to be, delivered to their wards, and then where we don't reach, the radio signals cannot reach, we try to give some, home learning kits, where with the guidance of the caregivers and the learning facilitators in the communities can try to, guide the learners to engage them and be learning. Then we also have a info line to caregivers. Just messages will be sent through a voice call. Then these voice calls will, try to, guide the caregivers in the, giving them some tips. The lessons that are, they are all tied with the radio lesson. They review the lessons. It will be taking them to any of the lesson of the week they desire to listen. Now, specifically speaking on the SEL, on this intervention, the remote learning intervention, and the radio instructions are introduced with mindfulness activities to bring the children back to focus, so that they can listen to the literacy and the numeracy lesson that will follow. So SEL is embedded into the literacy and numeracy instruction. Every 30 minutes radio lesson is introduced with SEL's activity. And then at the end, some health tips are given to the learners. The core of our distance learning approach is interactive radio instruction. That is the core. Radio listenership in that particular content in our region is relatively high, and majority of our learners have a family member with a basic cell phone that can receive a radio signal. For basic level lesson, each lesson is based around a story written by local authors with a literacy, numeracy, and SEL themes aligned with our accelerated curriculum. The SEL team is supported by interactive activities, including discussion questions, mindfulness, and brain games. For post-literacy, one of the radio lessons is post-literacy, actually try to introduce English to those who have, undergone the basic program. So at this level, SEL is integrated through English language lesson with mindfulness and brain games supporting language learning, in addition to interactive discussion and reflection in local language. All of the SEL content is tailored for the COVID-19 context and is coordination with messaging about health and well-being. So that is about the radio program we are adding. So the SEL activities in the radio program is tailored to the mindfulness, the brain games, and then the discussion question that are embedded in the radio scripts. And then the home learning kit for learners in remote or conflict-affected communities without access to radio signals. Learners receive a packet of paper activities that can be led by a caregiver of any literacy level. The SEL section includes positive parenting tips and an illustrated conversation guide that support messaging from other SEL modalities, including coaching calls. There are coaching calls from the LFs, that is the learning facilitators, to the caregivers to ensure that what is contained, what is received at the radio lesson, and what is contained in the SMS to the caregivers are fully implemented. Then the other intervention is the just last mentioned, that is the coaching calls to caregivers. Every 2 weeks, each caregiver receives a call from their child's learning facilitator to monitor their learning and provide coaching on literacy, math, and PSS-SEL and caregiver well-being. So that is the package regarding the coaching calls to caregivers, that is bi-weekly call. Then the SMS is saved. The caregivers receive 3 SMS per week, one on literacy, one on numeracy, and the other one on social emotional learning. They use simple local language and are formatting to be useful to caregivers of any literacy level, such as highlighting the letter their child is learning that week. So the message, SEL message contain example of some of the SEL messages contained in these caregivers SMS is like, children like to feel useful. If your child is bored or misbehaving, ask them for help with small tasks like sweeping the floor, and then praise them or praise their work. So these are some of the tips that you'll be sending out, guiding the caregivers to give some to impact some SEL skills on the children as they stay home. So the whole package is just directed as engaging the children, taking care of their social, emotional, and the cognitive well-beings while they stay at home, so that whenever schools are resumed, we are not starting from the scratch. We are going to continue with learning proper.
Yeah, thank you, Dr. Wakil. I will add more to the info line. We have a toll-free info line where caregivers and parents have access to audio-guided SEL and PSS activities. They can call anytime. They can get audio support. It is already embedded. It's toll-free. And whenever they call, there are simple activities that are in the info line. Activities like allowing children to play with their siblings, things like asking older ones to help the younger ones sing a song or play a game together, or things like sharing things that are joyful within the family. So the info line is very important, that at any point in time, a parent or a caregiver can call. It is toll-free, and once that is done, the person can have access to recorded audio-guided PSS activities.
Yeah, thank you. So the hallmark of all these interventions is just as from the definition of PSS as given by Rachel at the introductory stage, is for us to, to keep the children engaged, and then take care of their cognitive, and then physical in terms of health, because there are health tips, then social and emotional well-being. So, so that the crisis that causes that adversities would be overcome. So the target is for the learners to be active, survivors, rather than being passive, onlookers or passive victims, as the saying goes. Thank you.
Thank you so much, Bem and Dr. Wakil. That was an incredible presentation. A couple of things that really stood out were, you talking about PSS and SEL as a protective and restorative approach, and that learning can't take place without these components. So really having to have these 15 hours of SEL prior to any academic learning. And also just the multiple modalities that you're delivering PSS and SEL through during the COVID-19 pandemic. It really, makes you think that you think you've thought of everything, but you really haven't, because, we've got this info hotline that you can call free, and SMS to caregivers. And really covering the low tech, no tech divide, which it's not just an issue for contexts like northeastern Nigeria. It's an issue in the Western world as well. It's an issue in the UK, it's an issue in the US. So that's, this equity issue that we're talking about. Really this helps us think outside the box. How can you reach those hard to reach children and families? So absolutely wonderful. Thank you so much for that presentation. Now we have a recorded presentation from our colleague who works for NRC, that's the Norwegian Refugee Council in Amman, Jordan, Rana Al-Sharif, and she's a technical coordinator for NRC. So we're going to hear from her just now.
Hello everyone, my name is Rana Sharif. Hello everyone, my name is Rana Sharif.
Sorry about that.
No problem.
Hello everyone, my name is Rana Sharif, the Technical Education Coordinator of NRC Jordan. I really would have liked to be there with you all during this exciting webinar. However, I hope this recording will provide you with useful information. The Education Core Competency in NRC Jordan works in the Syrian refugee camps of Za'atari and Azraq and the hosting communities in Jordan, in the governorates of Irbid, Mafraq, and Amman. Our programs mainly support formal schools to provide children with a school environment that is safe, inclusive, and ready for teaching and learning. So currently, there are over 650,000 Syrian refugees in Jordan, with many children and adolescents in need of education. So at the start of the Syrian crisis back in 2012, the Ministry of Education prepared for this sudden increase in student enrollment in formal schools by expanding the number of double shift schools. So there are 204 double shift schools in the host communities where Syrian students attend the second shift or the afternoon shift, and there are 51 double shift schools in the camps, with girls attending the morning shift and boys attending the afternoon shift. Many Syrian refugees and vulnerable Jordanian children showed signs of reduced well-being. So these signs include increased isolation and loneliness, violence, anger, anxiety, lack of sleep, illness, and many other symptoms. We also saw that this stress and reduced well-being was affecting students' learning outcomes. As a response, NRC designed the Better Learning Program in collaboration with the University of Tromsø. The Better Learning Program, or the BLP, offers psychosocial support to displaced and conflict-affected children between the ages of 6 and 15 to support their recovery from the trauma of conflict and displacement and improve conditions of learning. So the BLP consists of three phases of program intervention: the BLP1, BLP2, and BLP3. The BLP1, it's a general, classroom-based psychosocial support approach that targets all children and young people. Then there's the BLP2, which is a small group intervention that supports resilience amongst a more specific target group of academic underachievers. Finally, the BLP3 is a specialized clinical approach to address nightmares, which many children experience as chronic symptom of traumatic stress. The BLP program as a whole is very interactive, as it allows children to understand their emotions and express their feelings. In each session, students are provided with emotional regulation exercises, breathing exercises, and balance and concentration exercises. So the teacher leads the session with the students, thus building a trusting relationship and creating a safe learning environment for the children. The Better Learning Program is a regional project, so it's implemented in Jordan, Palestine, and Lebanon, and each country has contextualized the program to meet their needs. In Jordan, before the COVID-19 lockdown, we had a couple of modalities to implement the program. So in the Azraq and Za'atari refugee camps, NRC builds the capacity of teachers to understand the importance of psychosocial support and understand the meaning of well-being and practice sessions from the Better Learning Program manual. This initial training or workshop is then followed by shadowing, where teachers observe and shadow experienced facilitators. Then, the next step is co-teaching, where the teacher and the facilitator implement sessions together. Finally, the teacher implements the sessions independently. So throughout this process, the teachers feel supported and that they are able to build their confidence in these sessions. So students as well really like the program because it takes them out of the routine of everyday classes. They get the chance to move around, express themselves, and they even lead breathing sessions, or balance and concentration exercises with their peers. So they also learn valuable skills such as organization, time management, reading comprehension, and active listening. In the host community schools, the situation is slightly different. The Better Learning Program is embedded in the summer school project. The summer school is a month-long remedial program that targets academic underachievers. The subjects taught are English, Arabic, math, and life skills. What's also different in the summer school is that students from the morning shift and students from the afternoon shift are sitting together in one classroom. So this means that Jordanian and Syrian students become classmates and friends. Here, in the summer school, the Better Learning Program is embedded in the life skills curriculum. So the same activities of emotional regulation and study skills are present in this program. So here what's exciting, as I probably mentioned before, is that students are given the chance to express themselves, they're able to get to know one another and bridge the barrier that exists between them. So many of them even become friends with one another, and this wouldn't have been achieved if they had not participated in the summer school program. So during the COVID-19 lockdown, the main challenge was the ability to access learning and services. Similar to all countries worldwide, so Jordan adopted the distance learning approach. So using an online platform called Noorspace, and then there's the national television channels, Darsak, which means your lesson in Arabic, to deliver academic content. So the challenge here was that many Syrian refugees and vulnerable Jordanian children did not have access to reliable internet connectivity or to internet connected devices. So many homes also only had one television set. So if there was a family with multiple children, not everyone got the chance to watch the lessons as they were broadcast. So add to that the lockdown was exacerbating the children's psychosocial needs. Due to the sudden change in routine, there's stress in the family, economic situation of the family, and much more. So on our end, we wanted to continue supporting teachers in their roles as they supported children. So what we did was that we set up a community of practice using the messaging platform WhatsApp, where we shared with teachers the Better Learning Program mobile application. So the application is intended for those who are already familiar with the Better Learning Program. It uses animated and interactive videos to explain content, which is then followed by a quiz, so which allows the participants to unlock the next content and move to the next chapter. This gamification aspect motivated teachers a lot to continue using the application, and it also served as a refresher for them for their knowledge in the BLP. So after sharing the app with the teachers, we also shared the video files from the app. So the teachers then, what they did is that they posted these videos of the Better Learning Program exercises on the school's Facebook page. This is where they asked children and their parents to practice the exercises. Now, on our end, this proved to be a very successful model, as many children and parents posted responses and videos of themselves practicing the exercises. This also helped in increasing the engagement of parents who suddenly found themselves in a difficult situation of having to not only support their children's learning, but also teach the content as well. So during this difficult time, the teachers really felt supported because they had a network of colleagues whom they could discuss lessons learned and reflections with using familiar platforms such as WhatsApp. So also when it was possible, we used Zoom to conduct trainings as well with teachers. And this was really appreciated because during the lockdown, teachers felt engaged during these trainings. The pictures here, they show the application, what it looks like. And also there's a screenshot of a school's Facebook page where students were interacting. Thank you all so much for your time, and I really hope you found this presentation beneficial.
So thank you, Rana, even though she's not with us, but that was a wonderful presentation that she prepared earlier. So yeah, a very different context in Jordan, speaking specifically about Syrian refugees' access to education, psychosocial support, and social and emotional learning. So something, you know, I wanted to highlight, I guess, is this these double shift schools, which is quite a common experience for refugees in host communities, because there simply isn't the capacity. And it made me reflect upon some attempts at schools reopening and in Europe, who are doing something similar because they have to maintain the social distancing within the schools. So they're turning to using double shift schooling, which is completely new, obviously, for these contexts. So there in Jordan, and also within the camps, there's just better connectivity, and you can see that there's more of a technical solution to the COVID response. So using this app to support the teachers, who are in turn are supporting parents and children. And I really liked that idea of the teachers posting videos of themselves doing the exercises, and then the students and the parents responding in a similar way. So on to our final presentation. We're now going to hear from Iman Mazloum. Iman is from Syria, but she now lives in Egypt, where she's teaching in, I believe, in Alexandria. Iman, I think, is going to present in English rather than Arabic. We will see, but she has the support of her colleagues who work with Plan International, Aya and Huda, and they will be supporting Iman with her presentation. So over to you.
Hello everyone, this is Aya Saeed. I'm going to present Iman first and then she will come in. This is Aya Saeed I'm a project manager in Plan International Egypt. I'm managing a project which is concerned with education and emergencies. It's an eco-funded project. We are supporting 10 Syrian-led learning centers over 4 governorates across Egypt. And also we are supporting 8 governmental schools in Egypt over the same 4 locations. This project has a lot of interventions, and we are implementing it over 4 years now. Some of the interventions are related to well-being and the economic circumstances of the refugees here in Egypt, which are related somehow to the cash grants and so on. But what we are talking about today is the interventions related to the psychosocial support or the social cohesion activities. We are somehow working on building a community-based committees called the Education and Protection Committees. It's some sort of a committee inside the learning centers. It's mainly for service community mapping across the communities of the projects. Also, we have the referral mechanisms over the locations with different organizations and different stakeholders, whether governmental bodies or different or sister organizations. Also, we have the capacity building trainings for Syrian teachers and for the Egyptian host communities and the Egyptian teachers for the psychosocial support. And finally, we have the social cohesion activities between the Syrian Syrian students and Egyptian students in the same communities. This is a very brief introduction about our project, and the rest of our presentation will be a little different from other people. She is a Syrian refugee teacher here in Egypt. She is gonna present her story coming from Syria along to Egypt, and what was the main integration challenge when she came to Egypt and how she overcame this. And she is gonna talk more about her center. She was a teacher, and then she managed to open a center here, a learning center here in Egypt. So I hope her presentation will be useful to you and her interventions in the learning center. So Iman, it's for you now.
Hi, I'm Iman Mazum from Damascus, Syria. I am a holder of Bachelor of Engineering Computer Section. I chose to be a teacher since I discovered my talent in teaching through mind simulation in and out methodology, and that was since living in Syria. I taught for 10 years there, where I began teaching my family children. Then I joined Syrian learning centers and nurseries. After Syrian revolution and moving to Egypt, I began to suffer like the majority of Syrians. While trying to adapt in Egypt, I had to search for a job right after my husband suffering from a heart attack for 3 successive times that hindered him from working. It was a real challenge as I found myself living alone in a new country with a new culture, and suddenly the household of my family, which consists of a sick husband and 5 children, whom I had to psychosocially support them, all due to the new circumstances of being migrants. Therefore, I tried to support my family through returning back to be my daughter's tutor using usual teaching methods, but surprisingly, she failed in mathematics, which I had a good experience at. I got depressed and decided to search for another job. I worked in sewing, but I failed. Then I worked in shaving after receiving a course funded by one of the organizations here in Egypt, but I also failed. I couldn't find myself in any job rather than teaching, so I had to focus my attention on Egyptian teachers and their ways of teaching Egyptian curricula. I knew that scientific rules in worldwide the curricula's contents would be the same, and the differences would only lie in explanation and exam questions. I became familiar with Egyptian teaching methodologies and searched for Syrian learning centers where Syrian students would need the Syrian teacher to understand his or her dialect, and that's before adapting with their Egyptian peers. I joined a Syrian learning center, which I soon left as I didn't like their teaching methods, and decided to have a learning center on my own where I can use mind simulation methodology. I got the chance, which has been the turning point in my life, when one of CTAs announcing the need for vulnerable Syrian beneficiaries in an intervention funded by Plan International for Shelter Renting Payment. I handed my husband's serious medical reports to CTA's committee, which accepted me to be a beneficiary. I received 3,000 Egyptian pounds, which was the first installment, and decided to search for a partner to have a small learning center. I found a partner, and we opened a small comprehensive center where remedial classes, meetings, and trainings could be held. We called it Development Talents, so that we would always enhance the children's skills and talents. The Learning Center became known to several NGOs, which gave the teachers and I the chance to receive several trainings in child protection, psychosocial support, and creative active learning methods. I had trainings as a positive parenting TOT, science club TOT, active learning methodology, learning center and administration, dealing with a child subject to violence training, child protection, psychosocial health, education in harmony, and school health. Another, they all helped me and all staff teachers in strengthening our dealings and personality. They served us in solving whatever problems we do face, especially psychosocial ones. 4 years till now, the Learning Center has dealt with Plan International Egypt and Caritas Care and UNHCR in several trainings which enhanced the Learning Center staff from several aspects. The first, educational aspect, science and mathematics clubs were formed to teach children scientific rules through interactive learning that aimed of developing child's imagination and creativity. Last two photos show students' interaction in them. Second, psychosocial aspects, child protection and psychosocial support trainings were very useful in identifying children's different attitudes, needs, rights, and how to deal with all of that for achieving a better future for him or her. These trainings have helped him personally well, supporting my family in reliving from war, trauma, and professionally through learning centers, tutors who acquired new methods of understanding children's rights and attitudes, which modified their following up and solving problems skills. In the early years of arrival to Egypt, psychosocial support was focusing on overcoming war repercussions that all Syrians suffered from, whereas during recent years after integration of Syrian and Egyptian children, psychosocial support became focusing on delivering children's rights everywhere with his family, colleagues, protecting him and her from bullying, violence, in addition to identifying his or her attitude, self, and differentiate between his and her problems, and differentiating between a child who has difficulties in learning and who is late in academic studies, a child who is hyperactive and another who moves a lot, a child who is alone and another who suffers from autism. I would like to mention an example of applying PSS in an incident with a student. During Aflatun trainings, students were drawing its logo. I found a 10-year-old child who refused to do so, and even participation in rehearsals, I decided to stop rehearsals, made them continue drawing, and I started to talk to him. I discovered that he has been insulted by his colleague, and he wants to dismiss. I convinced the later to apologize to him and that they have to respect each other. but still he didn't want to participate. I called his mother to know more about him, and I discovered that he suffers from violence from his elder brother. As a result of understanding this, I insisted on encouraging him as being the leader of the group, and that his colleagues won't continue unless he begins. And he did that, and everyone involving children's issue training. As a point worth mentioning, NGOs and organizations like Plan supporting the Learning Center with active learning materials that caused its expansion from 3 rooms to 6 rooms with desks and stationers. I want to talk about education before COVID-19, ordinary education depending on memorizing curricula, which I call copy and paste methodology, which lacks creativity and using student skills according to their multiple intelligence. During COVID-19 pandemic, schools were shut, academic years were concluded, and students were required to submit online research to obtain their final grades of the year. So the education system began to change as students studied online and depended on themselves in gaining required information. In that ways, students were classified into groups. A group that sought the aid of teachers and librarians to have ready-made searches without exerting efforts. Another group that liked the new system and showed his and her commitment and creativity in online researches, and used those new accurate research skills in developing themselves. The project supported us as a learning center and teachers at that time with the weekly virtual meetings to explore the MOE online portal, and regular guidance was there from Plan International side. Once more, psychosocial trainings have benefited us while dealing remotely with the students. While following up online researches with the students, I found a girl unable to do hair because of her family's financial status for affording a smartphone. She panicked as she couldn't as well seek help of anyone as she was prevented of going anywhere outside her home due to COVID circumstances. She started in smashing everything around her in rebellious acts of their status. Her father started beating her and decided to that she should get married and banned from getting educated. I talked to her online, knew about that, and went to her home while taking into consideration safety measures to calm down her parents and clarify more the situation. I made the online research with her through my smartphone. I also talked to her parents to stop the violent acts, and that there is an EPC at the Learning Center which would refer their case to INGOs if that happened once more. Expectation after COVID-19, wishing for methodologies that could encourage more creativity and enhancing education system to be a more interactive on whether online or offline, and that ensures more dependency of children on themselves. In in acquiring information and not just memorizing. Comments of photos. These two photos are for Aflatun initiative. My school is my second home, where students helped in cleaning the learning center, painting the pavement. It's aimed with increasing integration between Syrian and Egyptian students, in addition to asserting the right of living in the same place. Those posters indicate gratitude messages for Egypt, as it acts like a huge hug for Syrians.
Thanks for all. Thank you.
شكرا يا إيمان، أنتي شطورة جدا جدا. Thank you so much. That was a wonderful presentation. You can hear that the situation for Syrian refugees is very challenging, no matter which host context they're in. And Iman, as a teacher herself, is facing the same situation as her Syrian students. So it was wonderful to hear that the COVID-19 actually presented an opportunity in a way to make lessons more creative, and going for that like project approach, that research approach towards learning, which is absolutely amazing. So thank you so much, Iman, and